Bruce Gall from GMS Dental, and I wanted to talk to you about some of the things that we do. We have a full service dentistry, and we're very excited about a new product we have to offer. We've always offered an orthodontic product, and now we have an early orthodontic product called Healthy Start. The beauty of this is you start with children when they're still in their growth processes, because the mouth has grown and moved in a natural way, and the setting is perfect for future development, and they no longer need to have retainers. I'm very excited about a new product.
I was part of the United States Dental Institute, I still am, which is a continuing education course where you fly all over the country and get this advanced training in orthodontics. I'm a fourth generation dentist, and so my father is a disciple of Dr. Bergerson's from the early 80s and also attended the USDI. And Dr. Bergerson just changed his career in the early 80s, treated me and my two siblings, and really helped grow his practice in the 80s with a lot of little kiddos. And so what happened in the natural cycle of things, all of those patients he taught or he treated in the early 80s are now adults with their own children. So they're demanding the same results that they got in the 80s. So now they're coming knocking on my door saying, I want the occlusal guide, I want Orthotain, this is what I had when I was a little kid.
Once you know something better, or once you know almost like the truth or something new that was found, you know, that research found, you can't go back. To get the absolute best out of life, the Healthy Start should be on the very top of the list. Because once you have a healthy start, your whole, this affects the rest of the child's life. It's not just when they're small. It actually goes on and on into adulthood, and really it can actually make the person live longer. It's huge.
They're not twins. They're about 12 months apart, okay? About maybe a year and a half apart. Here's the sister. Big, healthy, open airway, okay? Here's her sister. Almost no airway. Almost totally pinched off, underdeveloped. She's way back here instead of being out. So when we use this appliance, it's going to bring this forward and it's going to open that airway.
Okay, so now I want to bring the camera around here and see what you see.
For me, I see it's narrow. It's not absolutely completely, a good open airway.
Without oxygen, just a myriad of terrible things. Heart disease is huge. With kids, ADD, they don't get enough oxygen, so they don't get reparative sleep.
It's about my cousin Justin, who lost his life to sleep apnea, and he was scheduled to have this surgery the day after Thanksgiving to have this. He had the sleep study done, and it was confirmed that he had sleep apnea, and he was scheduled to have surgery. And his roommate had gone in to wake him up the next morning because they worked out routinely. He was away at college on a scholarship at BYU, and they worked out every morning at 5 a.m. and Justin didn't wake up that morning. And his roommate had gone in and found that Justin had swallowed his tongue that night. And we lost him to something that could have been prevented if we had known about this type of technology or appliance that could have been available to him back in that time.
Just bad occlusion, bad bite, grinding, clenching. And now, which we didn't know that, I didn't know this till about 5 years ago, is that now sleep apnea is really the main cause. So we used to say that people were, they're all stressed with their job and it's so much stress and they're grinding. But in actuality, they really are in stress. They're just in stress to get oxygen. They're not in stress necessarily with their job and all of that. It's the stress to actually get oxygen, because your body is going to do everything it can to get oxygen.
You can't do a home sleep test on a child who's under 18. So we're like, well, how can we do it? What can we do? If we could get to them when they're young, they won't have the problems when they're old. And that's how we found this product. It's been a whirlwind journey. It's been phenomenal. Now you have all these parents calling us, with their stories and testimonials about what they're doing and how they're getting along with school and brothers and sisters and bedwetting and crowding, and I mean it's just remarkable to see.
Holistic type appliance that was going to treat the face, the airway, and the teeth. Anybody can straighten teeth. Anybody can put wire on, put brackets on, and straighten teeth. But the advantage of this appliance is it treats the whole body, the mouth. It treats the airway, the TMJ, and it straightens teeth too.
And if you wear it, your teeth get wiggly.
They get so that they can move right into place.
Yeah.
Okay, so tell me how the teeth move and where are they going?
They're going to get straight so you don't have to wear braces. You can get the healthy start, and it will straighten your teeth without braces. It won't be painful. This and this.
Okay, how about on the other side?
This cap and this tooth.
This to start with, and then you ended up with this. What would you think?
I would think that it's amazing, and I would love my teeth better that way than that way. Like right here, it's a crossbite, and these two teeth right here are in front of the two main teeth.
What do you think if you could have that?
Smile.
So you could smile and be happy with it?
Yeah.
How do you feel about smiling now?
I wouldn't say I'm afraid of it, I just like smiling.
Isn't it amazing how they can take this and just fix it by something you sleep with?
I started in orthodontics almost 20 years ago. When it was presented amazingly. I have never seen anything like this before. It's a natural way to help your child with breathing and sleeping and any other type of habits that they may have that fall under the conditions or the indications that seem to be a symptom that are necessary for use of the product.
And so having been 20 years in the industry, now being convinced of what this will do, is there any reason that you wouldn't want to use this?
No.
Is there anyone who couldn't benefit?
I think everyone could benefit.
What was the word you used for this?
It was the bridge that we needed in orthodontics. This was the bridge that we needed in orthodontics.
Did you call it a movement?
It is a movement. It is a movement.
You know, I like to get to the point where we're seeing 20 plus kids a month, and trying to make that big of an impact with some of these kids. And you know, that's kind of where I'm at. Is I don't know how big it is or can be, but I want to do the very best that we can to make as big of an impact for kids in their lives as we possibly can.
And they're not the most profitable patients in my practice because the children now adults who are treated with Orthotain don't have TMJ problems. They do not have relapse, so they're not Invisalign patients. They're our favorite recare, hygiene recare patients because their teeth are straight. They don't have a lot of buildup. They don't have a lot of decay. So while they're not profitable, they are our healthiest patients.
Are you girlfriends?
Yes.
I love it. Okay, how do you know each other?
We met in school. Yeah.
What would you tell them?
That it's really good, and you could wear it like if you suck your thumb, or if you have nightmares, or if you breathe through your mouth.
Then it helps.
Yes. Well, this device you put in your mouth, it makes if you have like a little space, it helps your space close in, and you wear it every night, and it lets my tongue not go forward. It just kind of pushes it backward.
So it keeps it in place so it doesn't keep moving your teeth. That's beautiful. Okay, tell me what it's like to sleep with that.
It feels kind of funny when you just get it, but when you get used to it, it feels fine.
Yes, we had no idea what was causing it. So to us it was a mystery as to why that was there. We thought it was something genetic, and to find out that it was just a simple way that she was holding her tongue at night and pushing it forward, and this device eliminating that, it's a we're glad to know that it's not something that their teeth were going to grow back in with the same way. This is actually something to be corrected early on in a way that she doesn't mind at night when she's sleeping, and it's working while she's actually getting better rest.
I mean, can you imagine if I could do 800 squats every night in my sleep? How amazing my legs would be, right? So if you can do 800 swallows a night to retrain that tongue, how great is that? And I can't predict how quickly a child's going to adapt to that, which is why we partner. It truly is a partnership with the parents, and we say we're in this for as long as it takes.
You don't want to show your teeth, do you?
I never show my teeth.
Why not?
Because I don't like to. Elijah.
Hey, nice to meet you.
Elijah and his sister Sasha finally come in for their evaluation. Dr. Taha and her assistant Danielle take a general history and observation from the parents or family as she examines her two new young patients. Elijah is 11 and Sasha is 10, so they're aware that the best window of treatment is starting to narrow. The clock is ticking. As they get older, the bones are setting and movement of the teeth slows and comes to a near end when they reach puberty. The doctor prepares a full report as she measures and records, takes pictures from every angle, standard x-rays, and may take an extended view. Next, they take a mold to replicate the exact interior of the mouth as a final piece of the picture for sizing and best impact. Dr. Taha shows me what she sees and explains the next steps of sharing all of this with the team of doctors at Orthotain, who over the last 40 years have done over 3 million cases worldwide.
Okay. The biggest issue that he has is the bite down we call it crossbite. You see the lower teeth overlapping.
Right.
It should be the opposite.
Right.
It's crossbite. I think it will help to widen his jaw. If you look here, okay, sweetie. If you look here, the reason for this crowding is the incomplete growth or insufficient growth of the jaw. If it's going to sit there for the upper and the lower.
Okay.
So it's not going to be like separate upper and lower. So it's going to work on both. But we're going to do something special for him, which we call it the G-Series, which is going to be like designed on his teeth. So and that's the active appliance. It makes a big sense that what we are doing here is trying to help the natural growth of the jaw, of the bone. We're trying to correct the problems that happens earlier in the kid's life when they're not when they are not given the right diet or breastfeeding and this stuff.
In history, when women had time to breastfeed, the child's whole oral cavity was developed in the proper width, height. A lot of times there wasn't even decay. And now, with the way the everything is industrialized, that without the mom breastfeeding for a good 2 years, and we used to also think it was just the actual breast milk, which yes, that's important too, but it's actually the mechanical sucking ability of the mouth and the jaws to actually form the proper mouth the right way. And also we have everything mushy for our kids, and now we've also found with that they need harder vegetables to actually develop the jaws. So I think Healthy Start is really has done a great job in bringing all of that together.
So we're trying to correct this, and it's always better to do it as soon as possible. And if we do it earlier, we will get much better results than do it later.
And if we didn't do anything, what would be the next step for him?
If we haven't done anything, the orthodontist.
I first met Dr. Bergerson in the early 80s as a young practitioner. And what I found was I had a lot of orthodontic patients that I was referring out that were coming back 6, 7, 8, 9 years old, and the orthodontists were telling them, you know what, you don't need treatment, just wait. And then when they waited, they came back, they had bicuspids extracted and, in other words, permanent teeth extracted. And I wasn't real happy with what the profiles and what was happening with their TMJ and what's happening with their airway, even back in the 80s.
It has always been, my patients were always like, you know, I went to this orthodontist and they want to take out my son's teeth and I don't want to, what do you think? And I was all, I was always like, you know what? That's not good.
Here, where we are, the average case for orthodontics for braces is between $5,000 and $7,000. So if it's, you know, to do Healthy Start, we're half that price. And so, you know, you're half that price, you solve all the issues, all the problems, all the airway, future sleep apnea, and as the bonus, the cherry on top of the cake is you have straight teeth.
Mm-hmm.
So, I mean, it's...
Find fault with that.
Exactly.
But I've been talking to my mother, who is very skeptical already, because you know, I had braces and my brother had braces, and she's like, I don't understand, what is this going to do? And I mean, I have been explaining to her that I already see a difference in Mia's, just how she is when she wakes up in the morning, and I see a difference in her teeth are actually starting to kind of self-adjust, which is shocking to me, but I can see a difference.
It's very common for orthodontists to wait and watch until a kid is 12. Now all the teeth have erupted, and what do you know, those permanent teeth are bigger than the baby teeth. There's so much crowding. Well, now what are we going to do? The kid's done growing. We need all this space, and we can't find it. The only way we can get it is to take healthy teeth out. So we're going to take out these premolars on the top and bottom. That's commonly what happens. Take out all 4, or worse yet, only take out 2. And you know, Dr. Berkson actually, I was so fortunate just to listen to him talk. And sometimes I'll throw a question. He is one of the most generous people I've ever met with knowledge. He will just, it doesn't matter how many times you ask him a question, he will answer it in a way that you understand. He's just amazing. And I remember one time I asked him very point blank that exact question. I have a patient, an orthodontist, who sends a kid over for extractions, and you know, I just don't feel right about it. And his response was, it's malpractice, don't do it.
But I'm really glad that we found out about it, because again, I was not comfortable with what the orthodontist was telling me, because I didn't understand why teeth needed to come out in order to make a good smile for Mia.
You can pick, there's like 4 or 5 different cases, and I like this cat, and inside here is mine. It's much easier to sleep, and I have to close my lips all the way, because if I open it, like, that won't really do anything. So I have to close it. And the first night, I was like, I don't think I'm ever gonna be able to sleep in it, but now I'm like, this is so easy. Like, I could do this, like, it's just so easy. When I brush my teeth, I put it on, and when I go to sleep, I keep it on. When it's morning, I take it off.
So you started her when she was 4. Mm-hmm. So that's really early. Mm-hmm. But why did you make that decision, and what would you tell other parents about why it's a good idea?
In the beginning, you know, she wanted to start sucking her thumb, so that's my main reason as a father. I wanted to put that in there so she wouldn't grab those early habits, and she was just fine. I thought that she was just going to put it in her mouth and not wear it, but it's great that during the time that, you know, it's about bedtime, they just want to go to sleep, so their cooperation is very high as far as, you know, putting an appliance in and have them wear it. Now, as a practitioner, I wanted her to start early because the ligaments around her teeth haven't formed yet. They're still trying to form in there, so as far as, you know, when those teeth do become permanent on there, they'll be able to get straight and you know, have less of a relapse.
I had a healthy start.
Eggs, like normal eggs.
But you know what? That was kind of good. I kind of liked it.
Okay. As new teeth have grown in, it's made a huge difference. I can tell they can come in straight, and they have a place already prepared for them to grow in, and they're not coming in at angles. The way I saw hers come in before, and the way I see her friends' teeth coming in, it's a huge difference when I compare her smile to her friends of her same age group.
Like some of my friends, the front 2 teeth will be kind of spread apart, and then these 2 teeth won't have any room to grow in. Some of my friends this year, they came back from the summer and they had retainers, like the ones that go on the roof of your mouth. One of my friends who was in my class, she didn't have the hooks on it yet, so it didn't stay, and she would have to like take it out. One time she left it outside after lunch on a napkin when she had taken it out to eat, and she got so scared.
And then just seeing her friends have to go through the braces process and all the expanders and all of that, it's almost heartbreaking. I feel bad that they don't have the appliance that Ainsley has.
Oh, he said, so lucky you get a retainer. My braces pop like once 3 weeks.
Yeah.
Oh. Stinks.
Yeah. It just seems like so much more work for the parents and the kids, and just a lot of pain that they could be saved from.
And at first, I thought I didn't want it. And then after a few nights, I felt like I liked it. I liked it.
He doesn't really have issues. He's a great kid. But what I see with the dark little circles with the mouth breathing is even though he's such a great kid, he could be awesomer.
If he had a runny nose or a cough or anything, I mean, he was up and down all night long. So I think it was more of a restless sleep.
You breathe through your nose when you have it, and you breathe through your mouth when you don't have it. That it kept my tongue from pushing my teeth.
Will his tongue stay in place because he's retrained it?
It will.
They looked sideways and crooked in all the ways that my mom has them.
Now that his habits are corrected, he's smile real big for me, buddy. He's going to start losing some teeth, and we're going to passively erupt those teeth right where they need to go, so that open real big. Let me see those bottom teeth. Open like this. Say ah.
Ah.
So those are permanent teeth there in the front. Look how straight they are.
They're beautiful.
They're beautiful. They're right where they're supposed to go, where they need to be, and he'll never have that anterior crowding or that spacing issue that so many people have. Both of his parents have that spacing issue, and so they wanted better for him, so those teeth are right there, and he'll never have relapse because the periodontal ligament fibers attached right to those teeth, right where they needed to go.
This was not a hard choice because it wasn't very expensive, and for the lifetime benefit that he's going to get and never having to worry about his teeth moving or anything like that, it was kind of a no-brainer.
So I'm a disciple of Dr. Parkerson, and I'd like to thank him for the training and the going out of the box and sharing this information and showing this information to general dentists, when at the time it wasn't real. It was a paradigm shift. General dentists, a lot of people felt like they should be doing this kind of stuff. They didn't have the formal training. But it helped a lot of people, and I'd like to thank Dr. Parkerson for that.
So Healthy Start is going to be a part of the rest of your life. So I encourage you to get educated, ask your dental providers what Healthy Start is about and how it can change the rest of your life.
Yes. Thank you! Thank you!
Love it, love it, love it.
I think we have recommended several friends. I just am so thankful that there's a simple, painless way that they can go about it, and something that just works into your normal daily routine.
Thank you for this device. I really love it, and it helps me so much. And I'm glad you made this. Thank you. If you come to see my mom, she can help you, and if you're really good, you get to get a prize out of the treasure chest or some stickers.
Dear Dr. Taha, thanks for teaching my teeth a lesson. I love Theodore, my habit changer. That's what I named him. So happy to know that I won't need braces. I wish I knew about this before I was 11. Now I tell everyone, P.S. Don't wait.